So how we do survivorship is one of the interesting academic questions I think facing us today. We're seeing more and more survivors, and the success of our multidisciplinary clinic in taking care of the patient while they have cancer is undoubtedly been a tremendous success over the last 20 years. What is interesting, and you have picked up on, is the need for multiple subspecialists to take care of the survivorship patient. And the patient who is surviving from cancer or with cancer has multiple different needs, and those needs are not necessarily filled by one person. And so as we move towards a survivorship clinic, one of the things that is becoming clear is these patients are being seen in a single space, but we're calling on multiple subspecialists to come in and evaluate them in that space. So you have, some patients have pelvic floor disorders, and so you have a rectal surgeon, a GYN surgeon, you have a gastroenterologist figuring out how does the pelvic floor work better in all the functions that it does. And so all of those people are converging on the patient to try and help that patient survive as best they can from either the side effects of the cancer or the side effects of what we did to cure them of that particular cancer. And you can imagine that occurs all over the cancer center. So people who have head and neck cancer have very similar multiple problems that go wrong where they need multiple subspecialists. You need people with experts in airway and nutrition. You need people experts in hearing. You need ENT experts who can help with dry mouth. Lung cancer, it's the same thing. GI cancer, it's the same thing. Sometimes people have tremendous amounts of anxiety, and so you're bringing in the psychiatric oncology group that we've established to treat patients while they're going through the cancer treatment, but it's just as important to continue that aspect of care post-treatment for the cancer. And so I think the multidisciplinary aspect of survivorship isn't going to be necessarily the surgical oncologist, the radiation oncologist, the medical oncologist. It's going to be the internal medicine PCP. It's going to be the psychiatric oncologist. It's going to be the pelvic floor person or the airway management person or the nutritionist. And so the traditional definitions of what goes into a multidisciplinary clinic is going to be different, except for the singular focus on the patient and having everybody come to the patient in that same space. And so I think you're going to see that play out more and more.
I would say for me, as a scientist, this is the most unbelievable period that we're living through in cancer. Starting a couple years ago and probably for the next 10 years, you're looking at revolutions of cancers that were untreatable that are now going to be treatable, new discoveries of why something does what it does and what you can do about it. And as a scientist, you almost have it at the tip of your fingers. You know, if you can only do this, find that, you could really have tremendous impact. And the excitement there is really palpable. As a cancer center director, it's about the people here who are so amazing. And whether it's a celebration for someone's award or just another conference or something else that we do, the people around here are amazing. And I sit back in awe thinking, my God, what a team we have and what impact we have. And again, the possibility of affecting people's lives and bringing together a team like that that does what it does is just amazing. And I would say, you know, a lot of credit, I would bring in a comment about Mara Bloom, our executive director, who, with her team, has really started a survival clinic. So the little things where all of a sudden you realize we need a survival clinic. People are living longer. We need to take care of them. We need a special clinic of cardiologists who worry about the complications to your heart of getting treatment for cancer. 10 years ago, you didn't worry about complications. So everything, we talk about sexual health and fertility, all the types of things which are the mark that we're winning, that we're doing well, because now we can worry about what would once have been considered little things. So that has an impact, and it tells you that, you know, there's a long way ahead, but we're starting to get there.
I guess if I could give one message, it would be, at the end of it all, make sure that the stories that you're telling about your experience here at Mass General are peak stories, and that the stories that people are telling about you are peak stories, and that you did everything you could with this incredible gift of a place. It's it's something that you don't want to waste. And as time goes by, you realize just how wonderful it is and what a privilege it is to have all of the resources. And I mean the resources, the hard resources, whether it's the physical plant, but the soft resources, the tradition, the sense of striving, and the people that are here. Don't waste that time. So I think this has been a wonderful way for us to express what we're actually thinking when it comes to the future of the MGH Cancer Center to the entire service. I think there are about 1,000 people who interact with the MGH Cancer Center on campus, employees of the MGH every single day. And we have to innovate in ways of presenting the vision and allowing folks to really hear on a personal level what our thoughts are and how we communicate them. So I think this is a great opportunity, and I hope we can take advantage of an ongoing dialogue.
We have phenomenal people here, and we want them to give to the best that they can and to be as dedicated as they can be. They're in a special institution. It's an incredibly old institution, yet it's incredibly young. If you walk around the Cancer Center, I mean, you know, some of us feel pretty old already. You know, the average age for our faculty is about 40. They're all in their peak. They're all excited. The buzz, they all are in touch with the latest discoveries and developments. So it's a phenomenal place, and we want everybody to give to the best of their ability and to feel like the institution appreciates them, their patients appreciate them, and hopefully they'll have a big impact on the way cancer is treated in the world. So we'll be here, and we'll be happy to kind of work together with as many people as possible to make this great place succeed.